Pregnancy is an exciting and sometimes anxious time for expectant parents. One of the most common concerns is whether the developing baby is healthy. Fortunately, there are many indicators throughout pregnancy that can provide reassurance about fetal well-being. Early pregnancy, first trimester, positive pregnancy test. The first sign of a healthy pregnancy is a positive pregnancy test. This indicates that implantation has occurred and the body is producing human chorionic gonadotropin, HCG, a hormone crucial for early fetal development. Absence of vaginal bleeding. While some light spotting can be normal, the absence of heavy bleeding is generally a good sign. Significant bleeding may indicate problems like miscarriage or ectopic pregnancy. Increasing HCG levels. In early pregnancy, HCG levels should double every 48 to 72 hours. Your healthcare provider may monitor these levels to ensure they're rising appropriately. Presence of pregnancy symptoms. Although uncomfortable, symptoms like morning sickness, breast tenderness, and fatigue can actually be reassuring signs that pregnancy hormones are present and the body is responding to the pregnancy. Visualization of gestational sac. Around 5 to 6 weeks, an ultrasound should be able to detect a gestational sac in the uterus, confirming an intrauterine pregnancy. Detection of fetal heartbeat. By 6 to 7 weeks, a transvaginal ultrasound should be able to detect a fetal heartbeat. This is a significant milestone and greatly reduces the risk of miscarriage. Crown rump length measurement. During early ultrasounds, the crown rump length of the fetus is measured. This measurement should correspond appropriately to gestational age, indicating proper growth. Mid-pregnancy, second trimester. Fetal movement. Around 18 to 25 weeks, most pregnant individuals begin to feel fetal movements, often described as quickening. Regular fetal movement is a positive sign of fetal well-being. Consistent fetal heartbeat. At prenatal checkups, your healthcare provider should be able to detect a consistent fetal heartbeat using a Doppler device. The normal range is typically between 110 and 160 beats per minute. Appropriate fundal height. As the uterus grows, healthcare providers measure the fundal height and distance from the pubic bone to the top of the uterus. This measurement in centimeters often corresponds to the number of weeks of pregnancy, indicating proper growth. Normal anatomical development. The mid-pregnancy anatomy scan, usually performed around 18 to 22 weeks, checks for normal development of fetal organs and structures. This comprehensive ultrasound can detect many potential issues and confirm healthy development. Adequate amniotic fluid. The anatomy scan also assesses amniotic fluid levels. Adequate amniotic fluid is crucial for fetal movement, growth, and development. Appropriate fetal size. Various fetal measurements are taken during ultrasounds to ensure the baby is growing appropriately for gestational age. These typically include head circumference, abdominal circumference, and femur length. Placental health. The placenta should be properly positioned and appear healthy on ultrasound. It should not show signs of premature aging or calcification. Cervical length. A closed cervix with appropriate length, usually over 2.5 cm, is a good sign, indicating a lower risk of preterm labor. Late pregnancy, third trimester, continued fetal movement. Regular fetal movement should continue throughout the third trimester. Many healthcare providers recommend doing kick counts, where you know how long it takes to feel 10 movements. This should typically occur within 2 hours. Appropriate weight gain. Both maternal weight gain and estimated fetal weight gain should fall within expected ranges. Your healthcare provider will monitor these to ensure proper growth. Stable maternal blood pressure. Normal blood pressure readings, typically below 140/90 minimum AHG, are a good sign, indicating a reduced risk of preeclampsia and other hypertensive disorders of pregnancy. Normal glucose levels. Passing the glucose tolerance test or maintaining normal blood sugar levels if diagnosed with gestational diabetes is important for fetal health. Negative Group B strep test. A negative result on the Group B Streptococcus GBS test, typically performed around 36 weeks, is reassuring. However, if positive, antibiotics during labor can protect the baby. Fetal position. As you approach full term, the baby should ideally be in a head-down, vertex position. This can be determined through physical examination or ultrasound. Appropriate amniotic fluid index, AFI. It is important to continue monitoring amniotic fluid levels. An AFI between 5 and 25 cm is generally considered normal in the third trimester. Reactive non-stress test, NST. If performed, a reactive NST shows that the baby's heart rate increases appropriately with movement, indicating good oxygenation and neurological function. Normal biophysical profile, BPP. A BPP assesses fetal movement, tone, breathing, amniotic fluid, and heart rate. A normal score, 8 to 10 out of 10, is reassuring. Absence of concerning symptoms. Not experiencing symptoms like severe headaches, changes in vision, sudden swelling, or decreased fetal movement is a good sign. Throughout pregnancy, normal maternal lab results. Regular prenatal blood tests should check for anemia, infections, and other health issues, and they should come back normal or be appropriately managed if abnormal. Appropriate maternal weight gain. Healthy weight gain throughout pregnancy varies based on pre-pregnancy BMI. Still, it is generally between 25 and 35 pounds for those starting at a normal weight. Stable emotional health. While mood swings are common, severe anxiety or depression can impact fetal health. Good maternal mental health is important for a healthy pregnancy. Monitoring and ensuring a healthy pregnancy. Regular prenatal care. Attending all scheduled prenatal appointments is crucial. These visits allow healthcare providers to monitor the baby's development, check the mother's health, and address any concerns promptly. Regular checkups help catch potential issues early and ensure timely interventions. Balanced diet. A nutritious diet, rich in vitamins, minerals, and essential nutrients, supports the baby's development. Folic acid, iron, calcium, and omega-3 fatty acids are particularly important. Staying hydrated and avoiding foods that could harm the baby, such as unpasteurized dairy products and high-mercury fish, are also key. Exercise. Regular, moderate exercise benefits both mother and baby. Walking, swimming, and prenatal yoga can improve circulation, boost mood, and support overall health. Always consult a healthcare provider before starting any new exercise regimen during pregnancy. Avoiding harmful substances. Avoiding alcohol, tobacco, and recreational drugs is critical. These substances can cause severe complications, including birth defects, low birth weight, and developmental issues. Limiting caffeine intake is also recommended. Managing stress. High stress levels can negatively impact pregnancy. Relaxation techniques such as deep breathing, meditation, and prenatal massages can help manage stress. Building a strong support system and seeking professional help when needed are also beneficial. Staying informed. Educating oneself about the stages of pregnancy, potential risks, and signs of complications can empower expectant parents. Reliable sources of information, such as healthcare providers, reputable websites, and pregnancy books, provide valuable insights. What to do if you're concerned. Despite all these reassuring signs, it's natural for expectant parents to sometimes worry. If you have concerns about your baby's health, contacting your healthcare provider is always best. They can provide reassurance or perform additional tests if necessary. Some signs that warrant immediate medical attention include severe abdominal pain, heavy vaginal bleeding, severe headache or vision changes, sudden swelling of face, hands, or feet, decreased fetal movement, leaking amniotic fluid, regular contractions before 37 weeks. Remember, every pregnancy is unique, and not all healthy pregnancies will display all these signs. Conversely, the absence of one or more of these signs doesn't necessarily indicate a problem. Your healthcare provider is the best source of information about your specific pregnancy. Additional considerations. Maternal age. Advanced maternal age, typically defined as 35 years or older at the time of delivery, can increase certain risks. However, with proper prenatal care, Many women over 35 have healthy pregnancies and babies. Multiple pregnancies. Twins, triplets, or higher-order multiples may have different benchmarks for healthy development, and these pregnancies often require more frequent monitoring. Pre-existing health conditions. Conditions like diabetes, hypertension, or autoimmune disorders may require additional monitoring and management to ensure fetal health. Previous pregnancy complications. If you've had complications in previous pregnancies, your healthcare provider may recommend additional monitoring or interventions. Genetic factors. Some genetic conditions can be screened for during pregnancy. Normal results on genetic screening tests can be reassuring. However, they don't guarantee a baby is free of all genetic conditions. Environmental factors. Avoiding exposure to harmful substances like certain chemicals or high levels of mercury contributes to fetal health. While pregnancy can be a time of excitement and anticipation, it's also normal to have concerns about your baby's health. These signs can provide reassurance throughout your pregnancy journey. However, it's important to remember that every pregnancy is unique, and the best way to ensure your baby's health is through regular prenatal care. Your healthcare provider will monitor your pregnancy closely, looking for these and other signs of a healthy pregnancy. They can address any concerns you may have and provide personalized advice based on your specific situation. Remember, many of the discomforts of pregnancy, from morning sickness to backaches, are signs that your body is adapting to support your growing baby. While not always pleasant, these can be reassuring indicators of a progressing pregnancy. Ultimately, the most important things you can do for your baby's health are to attend all prenatal appointments, follow your healthcare provider's recommendations, maintain a healthy lifestyle, and pay attention to your body. By doing so, you're giving your baby the best possible start in life.